When we're looking at a tear trough, there's three things we want to assess before we actually start deciding what the treatment plan is and if actually we're going to be treating. The first thing you want to do is something called the pressure test. We all know with the lymphatic drainage it's quite poor around the tear trough, so we want to make sure that is a normal lymphatic drainage, because if it's a poor lymphatic drainage, you're going to have more chance of getting lumps and bumps there. So what we do is in the center of the infraorbital rim, do a pressure test. So you just push about 80% of your force, let go, and you want the skin bouncing back and the color responding back. A bit like when you do a capillary refill when you think you've got a VO. So that's the pressure test. So 80% force, color. So it goes back to normal, so the pressure is here, the lymphatic drainage is quite good. The other thing we want to test is the skin laxity. And the way we do that is something called the snap test. So with the snap test, same again on the infraorbital rim, I'll pull the lower eyelid down and let go. And in most people, if they've got good skin laxity, the lower eyelid snaps back within a second. That's why it's called a snapback test. So I'll do that again. Finger on the infraorbital rim, pull the lower eyelid down and snap back, and you can see good skin laxity. The third thing we're going to assess is our volume loss. So with the patient looking straight, with the head facing straight forwards first, and then we'll ask the patient to look upwards, and then you can really see if there is any bone loss there. Because if they've got eye bags, they can look normal. If they've got eye bags, it could camouflage it. So we do that again, so if you want to look upwards, and that basically pushes the skin upwards, and you can see if there's any deformity there. So in summary, we'll look at the pressure test, the snapback test, and the volume loss.